Thank you very much. I'd like to start off by congratulating Minister McEntee on her elevation and the new position as Minister for State with responsibility for mental health and older people. And I know it's an area that you have a huge commitment to and a passion for, and I look forward to working with you to try and help to improve service provision that we most definitely need to do in the area of mental health. And look, mental health, Chair, affects issues. It affects people, all categories of people, you know, from male and female, young and old, urban and rural. There is no exceptions. But today I want to focus on young people, and specifically young people living in County Kildare, because Kildare has one of the largest populations of young people in the country, and the majority of correspondence that I've received and constituents that I've engaged with would be younger members of the community who feel passionately about this issue, who have either had who have been affected themselves or had close family members or friends affected by mental health issues. I believe much of the increased media coverage and discussion about mental health in recent years has been driven by young people who have suffered themselves or know friends or family members who have, and who therefore want to speak out about it themselves. For too long, mental health issues were not discussed or acknowledged in Ireland, even though they have always existed. Bringing discussion out into the open is one of the first key steps in helping to address these critical issues. Kildare, as I mentioned, has one of the highest rate of young people in the country. There are 77,832 people between the age of 24 and 0 in County Kildare, accounting for more than 1/3 of the population below the age of 24. This is one of the highest rates in the country and is considerably higher than the Eastern and Midlands average. Research carried out by the Children and Young People Services Committee found that current service levels in Kildare are not sufficient to meet the needs of these 77,832 young people in the county. However, Kildare is also one of the lowest funded youth services in the country, including those for mental health issues. That same report also highlighted that funding from the Department of Children per capita in Kildare in 2011 was €13.55 per young person. This was the third lowest per capita allocation in the state. Kildare is one of the lowest funded mental health services per head of population also, and this just isn't good enough, Cathaoirleach. We have the Lakeview mental health facility in Naas, and it's over 25 years old. It is a 29-bed unit that is in real need for a very significant capital investment. Lakeview, from my understanding, is constantly at in excess of 100% occupancy. We also have 10 beds as an overflow in Portlaoise that are used for Kildare residents. And in more recent times, on top of those 10 beds and the 29, we've had to go and use services in Tallaght as well. And this has very significant knock-on impact on support services. We also don't have enough high-level support hostel places that are used as step-down facilities from Lakeview, meaning that patients struggle to transition on from the service when their time is done in Lakeview. I understand that a proposed investment plan has been submitted for consideration to the Department of Health, and I would expect a decision to be taken on this as soon as possible to boost existing services in the county. Minister, this investment will be our attempt in Kildare to catch up with the rest of the country. Sometimes I feel that in Kildare we suffer from a presumption of wealth and our close proximity to Dublin. When it comes to mental health services, I believe that this perception has damaged us in terms of investment, and that must change. I was surprised to see this in the statistics provided by Mental Health Reform that 75% of mental health difficulties arise before the age of 25. That is frightening, but backs up the need for the services for our young people. Credit is due to many organisations providing services in Kildare and nationally. From the Great Samaritans to Pieta House, we have wonderful voluntary elements that are playing their part in providing the support needed to people when they reach out. We also have pilot programmes that need to be extended. Mojo is one such programme in Kildare Town, Minister. This pilot project for men over 18, funded by the National Office of Suicide Prevention, which has been very successful to date. While there is a commitment to continue the programme in 2017, the funding available through the NOSP is limited, so its future cannot be guaranteed. I would call on you, Minister, to ensure that Mojo and programmes like it, which are serving a real need in the community, are continued through the allocation of increased funding. The CAM service, the Child and Adolescent Mental Health Service in Kildare, is simply not fit for purpose. I've dealt with too many cases where the need has not been met by the service required. There are changes afoot to move those services into Kildare Town, into the primary care centre, but there seems to be some issue around funding from the primary care element. This is something I'll also be taking up with officials in the Department of Health to address this deficiency. But we have a very fine building that I think can really help improve the CAMS facilities, but it hasn't moved yet, and we need that to happen. We need that to happen very quickly. I've dealt with cases of children as young as 11 expressing suicidal ideation and needing to go to Pieta House as the services and CAMS in Kildare just couldn't assist. Again, that's just not good enough. While funding for mental health was increasing by 16% under the last government, more is still required after decades of neglect. We need to get our mental health funding up to 12% of the health budget to be in line with our international colleagues. I am sharing my time here, look, so I have an awful lot more I would like to say about vision for change and where we're at. But mental health is a huge issue, and I'll finish on this point that permeates many other facets of our society. And we have to improve how we deliver our mental health services, and if we do, it will go a long way to dealing with many of the other issues in our society. Continued investment in services on the ground is critical, and I will be using my voice to fight for that for as long as I remain a member of this House and beyond. Thank you, Carol.